So I'm a rheumatologist working in Tock, Seng, and I look after people with rheumatic illnesses. And rheumatic illnesses are illnesses where the presentation of the illness comes through the musculoskeletal system in most people. So what that means is that people who have aches and pains in the joints for whatever cause usually come to see rheumatologists. Okay, so this talk is only about muscular aches and pains. So aches and pains in the limbs and aches and pains in the spine. So I'm afraid I have to exclude things like pains in the head, eyes, ears, nose, chest, throat, all beyond the scope of this talk. And because there are so many things that can cause muscular aches and pains, I have to even limit it further to only certain kinds of aches and pains. So today I'm going to talk to you about what the cause of these aches and pains could be, what your doctor will want to know, when to seek help without delay, and some general principles of managing muscular discomfort and what you can do to help yourself. So if I just asked for a show of hands and said, who in this audience has never had muscular aches or pains? Well, judging by the fact that you guys have given up your Saturday afternoon to listen to me, I would be guessing that either you have or you know someone who has had muscular aches and pains. I certainly have. And the scale of the problem is actually huge. So 15% of our emergency department visits are for musculoskeletal aches and pains. 1 to 2 out of every 10 GP consults are for muscular aches and pains. And many, many more people just go and buy their own medicines, go and see the physios or pharmacists, or don't do anything about it. They just, get on with life. And so the scale of the problem is actually huge. And it's because the scale of the problem is huge, in fact, the number of things that can cause muscular aches and pains is also huge. And the causes can depend on the context and the history. So when you go to a doctor, that's what the doctor will be trying to determine. So if you imagine that you go to the doctor and you say, doctor, I have a pain in my ankle. And what could be going through the doctor's mind? Well, lots of things. The doctor will first be thinking where the pain could be coming from. The pain could be coming from the blood vessels. It could be coming from the nerves. It could be coming from the, it's not working. It could be coming from the blood vessels, the nerves, the skin, the joints, or it could be pain from somewhere else referred to the joint. So we're stuck here. Okay. And so when you have a situation like this, when someone comes and says to you, I've got ankle pain, when someone comes to say to me, I've got ankle pain, I would usually be thinking, is this problem something that is because of their work, or they've used it too much, or is it that they've injured it, or whether there's a nerve problem, or whether there's something else completely different. And so when you go and see the doctor doesn't have long. The average GP has 10 minutes to see and examine and decide what's wrong with you and what to do next. If you came to my clinic as a new patient, I've got half an hour with you. So in that time, what you tell your doctor is actually really crucial. Why is it crucial? Because depending on what you tell your doctor could decide, which road to send you down and which appropriate next steps can be taken. So the thing to do is really to keep calm. You have 10 minutes, but you need to help your doctor to help you. What you do need to do is to think about your symptoms before you get to the clinic. When did the aches and pains start? Whether you've ever had it before? Where exactly did it affect you? What made it better or worse? Did you actually have any time that you were free from pain? And did you notice anything else that was strange that came on together with the pain or came on before the pain, like fever or rashes or weight loss or anything else that's unusual? And please write it down, because if you think that on the day itself, you may forget the sequence of events, write it down or at least make some notes in your handphone. It's really important to be clear and specific about the history of what happened, because actually doctors rely a lot on the story that you tell us, okay? 80% of a diagnosis is made from history, and only 20% is examination and confirmatory tests. So, you know, if you were describing a bird to, an ostrich to someone, and you said, oh, I saw an ostrich today, and someone said, oh, what did it look like? And you said, oh, it had feathers and a beak. It could be any one of these three you see in the picture here, okay? So that's feathers and beak is not specific enough. You need to really think very hard about all those things I talked about how it started, where it affected, what made it better, and write it down. That will help your doctor determine what best test to do, who to refer you to if needed, and what other thing needs to be done. Also, while you're making a note, please also make notes on past illnesses and operations, who the other doctors you see are, and where you see them, especially if it's out in private, the medicines that you're taking. If you're not sure of the name or not sure that you can remember how to pronounce or spell the name, then bring along the bottle or boxes, or nowadays with the handphone, take a picture. Remember any allergies that you have, and any supplements, herbs, or TCM that you're taking. And when you're taking a picture of the TCM, do take a picture of the contents as well, not just the label, not just the name, so that the doctor can look it up or the pharmacist can look it up. So then people usually say, oh, but doctor, everything is in the computer. Well, I wish it was. Government restructured hospitals and polyclinics do share a computer system, but we can only see test results and prescriptions from about 2003. We can't actually see what the other doctor has written about you. And eventually there will be a unified system for consultation notes, but it doesn't exist yet. And as yet, private GPs and private hospitals and clinics can't see the information from government hospitals and polyclinics, and vice versa. So today, this slide shows us some of the causes of aches and pains in muscles and joints. In the pink is what I'm going to talk about. All the other colors, the green and the blue, are talks that I do give to Brown Center, but other talks that I'll give at another time. So we're going to talk about overuse, sprains, postural problems, degeneration, and shortage of vitamin D as causes of aches and pains in muscles and joints. Overuse injuries make up a lot of musculoskeletal problems. 50% of musculoskeletal problems come from overuse, and it can occur from stress on the bone, muscle, tendon, or ligament. And repeated stress can then cause the structure to become inflamed and painful, and then later on to weaken. One example is cleaning out cupboards at Chinese New Year. Women will clean out cupboards like that, and spend a lot of time cleaning windows and things, and then later on have a painful shoulder. Or recurrent hammering causing tennis elbow, or not being used to walking, but deciding that you're going to go for a round the island hike and ending up with a March fracture, a stress fracture of the bones in your feet. And generally for overuse injuries, there is a history of overuse, and the pain is localized to the area of injury. Poor posture. Well, since early 2020, when many of us have been working from home and using computers, many people have been hunched over their laptops, like this man down here, or trying to multitask like this woman here, entertain her child as well as do her work and sort out laundry at the same time. All this sort of hunching over like this, poor posture contributes towards neck and back pain. So how heavy is your head? Well, this slide shows that if you adopt a normal posture with your head set over your shoulders, your head weighs 12 pounds. If you are 2 inches forward like that, it starts to weigh 32 pounds, and 3 inches forward, like the posture that you would adopt if you were hunched over a laptop screen, it would weigh 42 pounds going through some of your discs. And the reason for that is if you imagine your head to be like a golf ball and your neck to be like the tee on a golf ball. When it's like this, all the weight goes through the center of the tee. As soon as you start tilting it forward, the strap muscles at the back here have to work real hard to pull the head backwards, and there is a top force on here which then transmits down through the discs and causes immense pressure on the disc and an apparent weight of much more than the true weight of the head. So the effect of posture, like a forward head, rounded shoulders, puts a great deal of stress on the lower neck bones, and it increases the shear stress, and it contributes to a degeneration of the joint in the neck over time. And on the left here is my MRI taken on the 1st of December 2020, as you can see, because I was having incredible neck pain and shoulder pain after trying to write up an assignment. After spending 2 weeks writing, or typing on my now broken down laptop, my neck felt distinctly uncomfortable and I was having shooting pains down my arm. And so I thought, this is really not good. I better, get an MRI and look at the state of my neck. And indeed, look at the state of my neck. So if you have a look here, this is the head. I'm cut in half like this, and you're looking at me from the side. This is the brain. This is the spinal cord here. And these are the bones. So bone, this slightly darker thing is disc, bone, disc, bone, disc. So the bone should look nice and square in health. And the disc is like a little shock absorber, like a little cushion that sits between the bones to absorb shock, because bones are rigid but strong. And if you were to have your spinal column made completely out of bone without any discs, it would be rigid. You wouldn't be able to bend. And the other thing would be that if you had even the slightest amount of trauma, slightest amount of jerks or anything like that, it would just crack because it is strong, rigid, but very brittle. So these discs in between break it up and they absorb the shock that allow you to do things like run and jump and things like that without injuring yourself. But however, what happens is that for all those hours that I spent with my neck like this, forward headed, I wore out this disc here, C5, C6, okay? And what, if you look very carefully at this bone is no longer square, and this disc is like a saggy cushion. It's bulging out. And where it's bulging out here, it's getting very, very close to the nerves that travel along here, and the nerve irritation is what caused my neck pain and my arm pain. So I know firsthand the effect of poor posture hunching over a laptop. So as early as 2013, when the iPhone was still new, there was this article that said, do you suffer from eye posture? So tablets and smartphones are causing an epidemic of back pain and neck pain as people hunch over devices. And at that time, they said 84% of 18 to 24-year-olds admitted to suffering back pain just because they've been spending as much time in front of a PC, laptop, or tablet as they do asleep in bed. Yes. So that's poor working posture. And what about poor standing posture? When you're waiting for the MRT at the MRT station, have a look around you. Just look around and look at people standing around waiting for the MRT. Look and tell me what you see. Or look and think about this talk. Look and see how many people stand up straight, balanced on 2 feet. Look and see how many people are having this forward head and flat back, and or forward head and sway back with tummy sticking out. All of these sorts of rounded postures can contribute towards neck and back pain. And for women who wear high heels, high heels tend to, so this picture on the right here shows what will happen if you do not arch your back when you are in high heels. So high heels, when you raise your heel, if you didn't arch your back to compensate for the raised heel, you would fall flat on your face. So women who wear very high heels increase the pressure on certain discs in the lower back, as well as certain discs in the forefoot. Sitting for prolonged periods of time also cause problems with the discs in the back. So if the pressure on the discs is counted as 100% if you're standing nice and straight and square like this, at different working postures, there is different degrees of pressure on the discs. So you can see that the worst possible posture is one where you are slouched forward. So what does all this mean? Well, together with aging, degeneration and aging and poor posture and repetitive use can all contribute towards increased degeneration of the body and the cartilage in particular. So if you have a look at this is an X-ray of the knee. Sorry, not X-ray of the knee, but a picture of the knee. And this white stuff here is the articular cartilage. Now, the normal articular cartilage, or the cartilage in a joint, is nice and smooth and white. And its function is to allow the edges of the bones to glide over one another. As we get older, our capacity for repair goes down. And so we are not able to repair as quickly as we wear out. So the balance tilts towards more degeneration, and the degenerative changes accumulate more, damage accumulates, and you get cartilage loss, areas where the cartilage is worn out, and bony spurs that grow. The reason, and you know, when people say, oh yeah, my cartilage is worn out, you cannot imagine that the entire block becomes thin uniformly, because it doesn't. It actually wears out in the way, like how our roads wear out. You start getting cracks and fissures, and you get bits where, you know, the tarmac has come off, and so you get like areas where it's the sandy bit at the bottom is exposed. So this is similar. You get bits where the bone is exposed, there are holes, and the cartilage becomes very, very uneven. So some people will say, you know, doctor, I noticed that my knees, they're starting to go crook, 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 crook. That noise when I bend my knees, that's because the layers of the cartilage are no longer smooth and even, and it's uneven surface rubbing against uneven surface, giving you that what we call crepitus, that crackling noise. So that's in the knee. And the bony spurs are areas of the bone that grow out. So for example, if you have a look here, this is the spine. Earlier on, I showed you that MRI. So this is the disc, this is the spine, this is the bone and the disc, and these are nerves that travel out. So when the discs start to wear thin, the bone grows outwards to increase the surface area, to reduce the pressure. that it senses, okay? And so this growing out bit is what forms bony spurs, or in medical speak, it's called osteophytes. In Chinese, they call it 骨刺, bony spurs. Yeah. So, if the bony spur grows over this area where you've got a nerve coming out, then the bony spur in certain positions could press on the nerve and give you nerve pain. So that's one, aging and degeneration is one cause of muscular aches and pains. Vitamin D deficiency is another. So even though we live very near the equator, 50% of Singaporeans are short of the sunshine vitamin. And it's not surprising because, we work, we go out to work at dawn and we come back at dusk, and we never see the sun. And vitamin D is increasingly being recognized for its role in more than bone and muscle health. It's also recognized to play a role in many other areas of the body, especially the health of the immune system. And deficiency in vitamin D can give you aches and pains, especially aches and pains at the end of long bones, and it can give you muscle weakness as well. So those are some commoner causes of muscular aches and pains, but there are also rarer causes and causes that are more worrying. You should seek medical advice without delay if you have increasing severity of pain. So if you have pain that is so severe that it affects your sleep or it affects your mobility, you need to see a doctor. If you have muscular aches and pains and you have fever that comes with that, or you're losing weight, you need to see a doctor. If you have aches and pains and you have numbness or weakness in an arm or leg, you need to see a doctor. If you have muscular aches and pains or aches and pains in your lower back and you have lost control or cannot pass urine or cannot open your bowels or you are soiling yourself, you need to see a doctor. In fact, you need to go to A&E without delay. If your joints swell up and they feel very hot or red or stiff, especially in the mornings, and it takes you 1 to 2 hours to loosen up, or in fact, the whole day you can't function, you need to seek medical advice because it's unlikely to be one of those conditions that I mentioned, or if it is a form that could be causing irreversible damage. If you have other strange symptoms that come on together with the joint pains, for example, you started having joint pains and now you're breathless, or you started having joint pains and now you're losing hair and you have rashes all over, all that is very abnormal and needs to be investigated. So for the other things where you don't need to seek medical advice immediately, there are things that you can do to help yourself even after you've seen the doctor, or before you see the doctor. There are things that you can do to help yourself. The first thing I'm going to say to everybody is that you need to educate yourself with reliable sources of health information. Health misinformation is pervasive. It pervades the internet. People come and tell me all kinds of things all the time. I was told by one of my patients a few days ago that she didn't take a shower for 5 days after having the COVID vaccine because she was told that if she didn't take a shower, she wouldn't get any aches and pains. Okay, and I asked her, I said, who told you that? And she said, oh, I went and asked everybody and everybody said the same. So, that's one, form of misinformation. There is a lot of health information out there, some of it true, some of it with only a grain of truth, some of it with 3/4 truth. But the 1/4 that is untrue can be so damaging that it negates the 3/4 that is true. So if you're not certain of how to evaluate sources of health information, I would urge you to look at this tutorial. The National Institutes of Health, Medline in the US, have got a very good tutorial on how to evaluate health information. The Health Promotion Board have got fantastic resources on all a large range of common conditions. So do go and have a look. And try and work out how to sort out the wheat from the chaff. Okay, so what can I do to help myself? If I have an overuse injury, I need to avoid the activity that aggravates that injury. So for example, if I have injured my shoulder with Chinese New Year cleaning, the thing not to do is to go and lift a 5-10 kilo weight like this person working on weights over here. I need to rest that area. I need to ice it or use a warm pack. And in fact, ice or warm pack either is fine, because both of it, neither is better than the other. It's whatever gives you relief. Some people find that ice packs work if they have a hot swollen joint, and warm packs work better if they have other kinds of overuse injuries. And you can use other pain relieving methods if you need. And then when you feel better, you can then see a physiotherapist or gradually start doing some strengthening and stretching exercises to restart as things improve. Protecting your joints and muscles is very important. If you are having early wear and tear in your joints, like me, protecting your joints and muscles is important because you don't want to accelerate that wear and tear. So for example, the middle picture here is a picture of, the old-fashioned clothes wringer, essentially the old-fashioned spin dryer, I suppose, where you put the clothes through and then it squeeze. By turning a handle, you squeeze the water out, rather than using your hands to try and squeeze large items of laundry to do that. So what I do when I do hand washing is I do my hand washing and then I drain off the water and I chuck the whole lot into the washing machine and put it on a slow spin cycle. So that I don't wring out by hand. I also have gadgets to open jars and gadgets to open cans. And rather than carrying heavy shopping, there's always the trolley. So find different ways that you can do the same thing without causing yourself further injury. Regular load-bearing exercise, moderate weight load-bearing exercise is important. To keep your muscles and joints healthy, walk. But please don't walk like this with your handphone, okay? You only have to go out to the park to see how many people are actually walking like this when they should be walking like this. So regular moderate load-bearing exercises can include things like yoga and Tai Chi. And remember to warm up and warm down before you get started on any activity. Warming up is important to increase blood flow to the area, to prepare it for exercise and to prevent injury, and to do some stretching to prepare the joints and muscles for exercise, and to avoid injury. So do not overdo it when you first start. Start gradually. We're not all going to run the Standard Chartered Marathon tomorrow. Okay, so don't overdo it when you first start. Just do it gradually and gradually increase the amount of exercise you do and the intensity as you get better and fitter and stronger. Weight management is really important. Being conscious of weight and losing weight if you're overweight puts less stress on the lower limb joints. If you look at the picture on the right-hand side here, you can see that if we carry a lot of weight around our middle in the front here, you have to arch your back here in order to compensate for the shift in the center of gravity forward. Okay, and your pelvis will have to tilt forward. So you get into this, what we call a kyphotic lordotic posture, and put a tremendous amount of stress on the discs in the lower part of your spine, causing them to wear out faster. In addition to that, new evidence also suggests that it's not just the lower half of you that is affected by weight. Even in the top half of you, which is not bearing weight, you can get accelerated wear and tear in joints like your hands if you are overweight, because your fat cells are not just cells of storage. These fat cells actually produce chemicals. And these chemicals are inflammatory chemicals, or chemicals that drive inflammation and induce damage to the cartilage and speed up the cartilage damage. So, and speed up that process of wear and tear. So in fact, it is not just about reducing the load on your knees or your hips when you're overweight, but also to reduce the amount of inflammatory chemicals produced. So, from the subject of weight, people usually say to me, oh, but doctor, how can I lose weight? And then my first question to them is, are you sugar aware? So, most people, most of us consume far too much sugar, and uncontrolled blood sugar, if you are diabetic or borderline diabetic, will speed up the wear and tear of the cartilage in your joints. And it can also affect how well your muscles and nerves work. So the amount of sugar that is too much for most people is 24 grams for women and 36 grams for men. How much is 24 grams? Well, 1 teaspoon of sugar is about 5 grams, 4 to 5 grams. So it's 6 teaspoons for women and 9 for men. So sugar really can cause a lot of problems, not just diabetes. And the sugar content in popular local beverages can be very high depending on the beverage that you choose. Probably the greatest culprit is milk tea and bubble tea. And I have seen patients of mine have liver tests that become abnormal just because they got into a milk tea drinking habit. One lady had a milk tea shop open just downstairs from where she lives. And so she started drinking milk tea every day since she was working from home. And her liver tests were completely normal, like 3 months before when she came to see me. And then after that, it started rising and rising. And I kept asking her, are you taking anything? Are you taking anything? And eventually she said, well, the only thing different is the milk tea that I have been drinking. And I said, do you drink it like with sugar? And she said, well, of course, that's the whole point of milk tea. Yes, so suffice to say that she promised me that she would cut out all milk tea for 3 whole months. And over the next 6 months, the liver test slowly started to come back down to normal. She also put on something like 5 kg in weight in the time that she'd been drinking the milk tea. So, it's not to be sniffed at, really. The people who like 3-in-1 coffee, I was one of them too, before I found out how much sugar there is in each packet. So if you want to work out, the quantity of added sugar, I find grams very hard to visualize. I tend to divide everything by 4. 4 grams being 1 teaspoon, and to count the number of teaspoons. And that usually is sufficiently enough deterrent. Just the thought of consuming like 5 teaspoons of sugar is enough to put me off. So it's up to all of us to make conscious dietary choices. Most of us know this. All the children in school have been taught this. This is the Health Promotion Board's Healthy Plate. And it demonstrates that we have to be taking a quarter of our food is supposed to be whole grain, 全麦, meaning that it's got the bran, the fiber part of the grain as well. So wholemeal bread, brown rice. And you are probably wondering why HPB are going on and on about whole grain. It's because consumption of whole grain has been shown not just to help improve your bowel cycle, it has been shown to help improve blood sugar control, as well as the whole grain fiber being fuel for the good bacteria that live in your intestines. So this good bacteria will go a very long way in helping to influence your health in ways that we don't see. And this goes beyond drinking those little Yakult, like little containers of Yakult, which is incidentally very high in sugar. Okay, so eat whole grain, lean meat and alternatives, and make sure that half your plate is filled with leafy vegetables. So you notice here that they put on here an orange and an apple. They haven't put on here orange juice and apple juice, okay? Fiber is really important. So juicing, I discourage it. I discourage juicing because juicing removes the fiber, which is the really important component to prevent sugar from spiking in your blood. So eat the orange, eat the apple, try not to juice. Make your smartphone work for you. The HealthHub app has got various things, like it tracks the steps that you are doing. It has reward programs. There are health programs on there as well. So I encourage all of you to have a look at it when you have the chance. Make sure you sleep enough. When you don't have enough sleep, your brain does funny things. It amplifies pain signals. And so aches and pains are made worse when you don't sleep well. And poor sleep, aches and pains influence sleep, but aches and pains are also made worse when you don't sleep well. So for many people, they may need some other form of treatment to help their aches and pains, such as painkillers, in order to help them gain restful sleep and break this cycle of pain going round and round. The other thing about sleep is that there is increasing evidence that if you don't sleep well, your body will overproduce certain types of hormones that will make you gain weight. So, and weight gain, as we said before, is associated with abnormal posture, as well as increased fat, which then leads to production of inflammatory chemicals, which then degenerates the joints even faster, which then leads to more pain. So it's all linked. So there are very many pain relieving methods that can be used: hot and cold packs, massage, acupuncture, warm baths, exercise, meditation, aromatherapy, distraction therapy, using shoe inserts, supports, braces. You can go on and on and on. And cane and walking sticks. All these can help and are very good pain relieving methods. There's also, of course, pain medication. And pain medication can come in many forms for joint pains. They can be pills taken by mouth. They can be patches that you put on your skin, gel that you can rub on, injections into the muscles or joints that the doctors can give you. And there are other special pain control methods as well for people who have it very, very severe. And for most simple aches and pains, if you haven't got any allergies to things like Panadol or Ponstan, simple medicines often suffice. But obviously, this varies from person to person. Some people are intolerant of very many pain medications and may need to seek advice from a doctor rather than use over-the-counter medications. The thing I want to remind you about pain is that it's like fire. So don't wait for it to erupt before doing something about it. Your Panadol is like a little bucket of water. So if you've waited until your small fire, you say, oh, I don't want to take painkiller, blah, because, I'll just wait until it gets very bad first, but doctor, my Panadol doesn't work. So if you know that you've got some wear and tear in your knee, and that going out to walk with the family around Gardens by the Bay will cause you pain in the knee, when terrible pain that night when you come back, then consider taking some paracetamol before you set off and some more when you come back, really to keep the fire small. That way you will not be up all night with the pain and sleep better, and the next morning feel better, and your brain's regulation of that pain thermostat will also be better, and you will overall may need less painkillers. So don't wait for the pain to become really big before doing something about it. And you may need to, every time you have a little flare-up of pain, you may need to take medicines regularly for a while to get the fire from down to a small fire again, and then cut down the medicines. So obviously all of this is a balance of risk versus benefit. Different people's bodies are different, different people's health conditions are different. And if you're at all uncertain about what to do, then you ought to discuss this with your doctor. So this slide is for people who have been diagnosed with joint inflammation. Not any of the things we talked about before, but inflammatory joint diseases like rheumatoid arthritis, gout, psoriatic arthritis, and lupus, and things like that. So these people have a very different category of joint pains. They have inflammation in the joint, and that inflammation is because their body's immune systems have gone a little bit haywire and are attacking the joints. So that's very different from age-related wear and tear. Joint inflammation can happen at any age. It can happen to young people. It can happen to children. Even the youngest person I ever saw with rheumatoid arthritis was 9 months old. So, and the only reason why they got diagnosed is because they were learning how to crawl. Okay, so and couldn't, and seemed to be crying every time they tried. So it's not all people who get joint problems only, but people who have been diagnosed with joint inflammation. You have to understand that the medicines that you've been given by your doctor has a purpose. Its purpose is to prevent the inflammation from causing irreversible damage to your joints. This irreversible damage is like fire burning a house. So you're not going to want to wait until the fire has destroyed the structure of the house before saying, oh, let's perhaps use that fire extinguisher that doctor has given me. Okay, you need to consider really educating yourself about your illness and looking after yourself, and taking an active role in management of your condition, and having discussions with your rheumatologist about your joint inflammation and what medication options are available for you, because there are a lot of medications available these days. For everybody, lifestyle factors are very important. So aside from all the sleep and things that we've talked about before, stopping smoking is paramount. Okay, so on top of all the other bad press that you have heard about cigarettes, I'm going to add a few more things. Smokers have faster degeneration in their joints compared to non-smokers. Smokers have much increased risk of autoimmune illnesses. Autoimmune illnesses are illnesses where the body's immune system attacks itself. And smokers with autoimmune illnesses like rheumatoid arthritis and lupus need much more medications to control their condition, because the cigarette smoke makes their condition much less responsive to conventional doses of medication. There is also an increased risk of heart attacks and strokes in smokers. So that's yet another reason to say that today is the last day that you take your, today I have smoked my last cigarette, okay? Moderate alcohol. Alcohol can worsen certain conditions like gout. Long-term consumption of alcohol can also reduce the density of your bones, increase the degeneration of your joints, and it increases cancer risk. So this is everyone's favorite bit. People will say, but doctor, can I take a supplement? Well, as with everything, it depends. It always depends on the situation, and it depends on the supplement. So if you have neck pain because you have spent the past 18 months, like me, sitting down, working like this, your aches and pains are not going to be helped by supplements. Your aches and pains will be helped by correcting your posture. If you are flat-footed and are walking like this because you're flat-footed, supplements are not going to help straighten your feet. What will help is insoles in your shoes. So if you use your arm and clean out all the cupboards and all the windows over Chinese New Year and have shoulder pain, supplements are not going to help that shoulder pain. Rest and then physiotherapy and strengthening certain muscle groups will help. There are very few complementary supplement medications that have been shown to have good quality evidence to support their use in degenerative arthritis. In rarer kinds of arthritis, like the ones I talked about with that burning house, the ones with joint inflammation, it is very essential to treat it early and aggressively. And none of the supplements that have been discussed thus far have any evidence that they do the job to treat it early and aggressively. So I would still recommend that you go and see your doctor if you have any of the immune-related types of arthritis. Be really careful. If you are told that a herb or a complementary therapy has no side effects, it's not going to have any effects either. Okay, there is no such thing in this universe that is all bad or all good. It goes against the law of nature. There's no such thing. So there's no such thing that has only bad effects or only good effects. It just doesn't work like that. Yeah. If it sounds too good to be true, it probably is too good to be true. Quick fixes are very rarely effective. Many people come and say to me, but doctor, your medications are not natural and I want something that is all natural. Well, all natural is not all good. Tobacco is natural. And do you recognize this plant? Many people like to eat this plant. This is katok or money type, which people have on ban mian. You may not know, or maybe you do know, that this very vegetable was responsible for an outbreak of fatal lung inflammation in Taiwan some years ago, because people took it raw. They felt that, they wanted the full antioxidant effect, but did not realize that this particular plant has got toxins in it that can cause inflammation and damage the body. So here are some examples of food that many of us eat. Maybe not the one down the bottom right-hand corner. This is rhubarb. I used to eat this a lot when I was in the UK because I like the sour taste, but the leaves are exceedingly toxic and can kill. The stems are not, and are very nice when they are made into pie. This is buah keluak, which is toxic if not prepared properly. This is starfruit, very, very high in oxalate. If you have kidney failure and you take starfruit, or kidney impairment and you take starfruit, you may have certain types of kidney stones, and there are reports of people being pushed into kidney failure after overeating starfruit. Tapioca, high in cyanide. If you don't know how to prepare it, every year there are reports of people dying eating tapioca. So this is all natural, and it can also kill you. So just because something is natural doesn't mean that it's good. Just because something is man-made doesn't mean it's bad. So more of a good thing isn't necessarily better for you. This is a situation that often happens in the clinic when I talk to people about the fact that, you're already taking calcium and vitamin supplements, but you are still osteoporotic and your bone density hasn't improved, and we need to give you other medicines. And they say, I'm taking 2 tablets a day now, doctor, I'll increase it to 4. Well, balance is the key for everything, be it for water, for vegetables, calcium, exercise, vitamin C, you name it. So these pictures here at the top shows you what happens to a landscape when there is not enough water. And the bottom picture is what happens when there is too much water. Okay, so if you want to achieve a good balance, you have to. It's more of a good thing. More water is not necessarily a good thing for you either. Yeah, water toxicity, brain swelling, fits, and death. The other thing to say is that more expensive doesn't mean more effective. Take the example of vitamin D. The best form of vitamin D comes from the sunshine, and it's free. Okay, and there are other myths out there. Some people believe that if I take this supplement 2 hours away from my Western pills, it won't have any effect. There won't be any drug interaction. Yeah, but that is assuming that your Western pill is cleared out of the body within 2 hours. Some people's pills last in the body for 3 days, and if that pills have to have a biological effect, it will exert the effect and be got rid of from the body, either from the liver or the kidney. And so that includes your herbal medication as well. So if it starts to compete with that Western pill, it may overwhelm that excretion system, accumulate in your body, and cause problems with toxicity and damage parts of the body. So we are in a region where we're quite fortunate in Singapore. HSA does regulate very tightly all the legal medications that come in, but there are unregulated powders and capsules that can be bought over the internet from neighboring countries, from all over the world. And I would urge caution, because they may contain banned substances that can affect liver, kidney, and cause severe allergies. Healthcare and the doctor-patient relationship is a partnership. If you are going to see your doctor about joint pains or whatever illness, it is a partnership. And therefore, as partners, it is important for us both to be upfront, the doctor as well as the patient, about what we are doing for our side in managing this illness. So if your doctor is giving you this particular medication and you find that it's not suitable and you're not taking it, go back and tell them, I'm not taking this medicine because of these reasons. Okay, and instead I have decided that I will be taking these medications, and then listen to what they have to say. Okay, remember to always inform your doctor about what complementary herbs you are intending to take, because of the risk of interactions. So popular supplements, I mentioned about vitamin D earlier on, is good for bone health, increasing evidence for modulating the immune system. Best is from the sun. How much sun? 10 to 30 minutes, 10 a.m. to noon. Noon is a bit hot, I think. So 10 to 30 minutes at 10 a.m. twice a week is sufficient to give you enough vitamin D that you need. Supplements help if you are unable to go into the sun, either for work reasons or for health reasons. There are some patients who are not allowed by their doctor to go out into the sun because they have certain conditions that flare up with sun exposure. For those people, they need oral supplements of vitamin D. And food that are rich in it include dairy products, apricots, oily fish, things like that. Okay, omega-3 oils. There is little evidence in degenerative arthritis for omega-3 oils, and as such, the latest guidelines for management of osteoarthritis or wear and tear degenerative arthritis actually do not recommend the use of omega-3 oils. In rheumatoid arthritis, it may reduce pain and reliance on painkillers, but it has to be taken at a very high dose, something like 12 capsules a day for 3 years before it reduces the chance of flare. But they still take their usual rheumatoid arthritis medicines in the background. And what's true also is, remember what I said about balance. So too much omega-3, doses higher than 3 grams a day, it interferes with blood thinning drugs and increases the risk of bleeds. If you're taking fish source omega-3, the sea is becoming increasingly dirty, and there are all kinds of impurities that are concentrated in fishes and in the fatty portion of the fish as well. So you have to make sure that whatever fish oils that you're buying for omega-3 have been distilled to remove mercury and other impurities, because otherwise you will be ingesting those impurities too. Glucosamine and chondroitin is a very popular supplement. These are extracted from shells, seashells, shellfish. There are 2 large studies that have shown that a small group of people with degenerative arthritis of the knee can have some reduction in pain and improvement in function of the knee if they take glucosamine and chondroitin. The interesting thing is that the only thing that improved was the score of pain and what they could do, but their x-rays and the scans did not show any improvement or slowing down of joint damage. So the joint damage continued, but patients felt reduction in pain. So other studies have shown that if it works in you, it works as well as conventional painkillers like Panadol. Because it is glucosamine is quite a large molecule. It can do things like upset your stomach. It can also affect your blood sugar, worsen glaucoma, and affect blood pressure. So it is not entirely a benign medication. What I say to my patients who come and ask me whether they can take it for moderate wear and tear, mild to moderate wear and tear, is that this is the evidence. If you find that it's not burning a hole in your pocket because it's too expensive and you want to give it a go, then give it a go for 3 months and see whether it has improved what you can do and has not adversely affected all the other aspects of your health. If so, and if you can afford to continue, and your blood tests and other aspects of health are not affected, then you're probably all right to continue. But if you find that, oh my goodness, I'm being beggared by buying this glucosamine every month when I could be using the money for something else, then I would not. Or if you've taken it for 3 months and you think, take, don't take, same only, then don't take lah. Yeah, save the money. Okay. The chondroitin is the other thing that thing that sometimes is added to glucosamine. There are some small studies to show that for hand osteoarthritis, it may actually help reduce pain, but there are more recent studies on cells that show that excessive chondroitin exposure can increase cancer risk. So I generally do not recommend these supplements unless patients feel that they do not want to take paracetamol, or they have some reasons for not taking mild painkillers when their pain is when they've got the symptoms and that the supplement really helps them. If so, and you're not getting any ill effects, well, it's probably all right to continue. Curcumin is a very popular supplement. So now, if you go into any health food shop, you will find that there are bottles of curcumin marketed as being very highly bioavailable and very easily absorbed. And yes, the active ingredient in curcumin does have an anti-inflammatory effect. it has been shown to act on a particular receptor in the cell to reduce the production of inflammatory chemicals, but there are problems. The problems are that over-the-counter, unstandardized formulations are flooding the market. The other thing is that many of these extracts contain other ingredients and contaminants. The size of the effect for joint pain, so if you take curcumin, it's also been shown to reduce discomfort, but not change the progress of the degeneration. Okay, and how effective is it? Well, it is just as effective as taking a conventional painkiller. The other downside to curcumin is that there are many reports in the medical literature about liver damage caused by curcumin capsules and curcumin supplements. So different people's bodies seem to react differently towards purified extracts of curcumin. Again, the same maxim, not always all good, okay? Yeah. Then, there are a lot of other supplements that people take, immune boosting supplements particularly. So popular ones are listed here, things like spirulina, alfalfa, chlorella, echinacea, blue-green algae. These probably don't do anything for wear and tear, but patients of mine that have autoimmune illnesses, so illnesses where the immune system is attacking itself, are highly discouraged from consuming any of these. And the reason for that is because if they consume this, they make more work for me, okay? Because they will come with flare-ups of their condition and increased need for medications to suppress the immune system. These are all associated with flares of different kinds of autoimmune illnesses. Some people say to me, I will buy my supplements from a reputable seller. Yes, this was an article from 2015 to show that many popular retailers here sometimes have products that actually don't, what is inside your capsule does not match what is on the label. Okay, so because if something is sold as a supplement, a health supplement or a food supplement, it is not subject to the same stringent regulations as proprietary medications. So prescription medications. So you are buying this, you are paying a premium for it, but in truth, we're not really 100% aware of what is in there. So this has brought me to the end of my talk. And the take-home messages that I would like to share with you and reiterate again are that many muscular aches and pains can be helped by or at least improved by self-management. A change in our lifestyle and a change in our habits is something that each of us can look into and look towards correcting in order to be able to minimize the effects that certain inevitable things can have on our bodies. So it is inevitable. If we, are fortunate enough to live a long and healthy life, it is also inevitable that because we are built like cars, we will wear out. And when the engine becomes old, it just needs a lot more care and a lot more TLC. So, now's the time to look at our lifestyle and our habits. The issues of food, so diet, sleep, stress management, and moderate exercise, cannot be understated. But these four, to change these four, is much more difficult than to pop a pill. Yeah, and that's why so many of us are so unwilling to do what is necessary or what is right, and they'll say, just give me that medicine. Once you give me that medicine, it'll all be well. Unfortunately, there is no such medicine. Okay, so some of these things, like the wear and tear, will be something that will progress gradually Some of it will be chronic, for example, my neck. And learning how to manage the symptoms is crucial. That's why now, today, I'm talking to you in front of my desktop with a high-backed chair rather than a low-back chair. And it's learning to adjust to the presence of the symptoms. So it's getting to know the new me, the new norm. Yeah, we all have adjusted towards wearing masks, using trays together. We also can adjust towards the new norm. So when in doubt, if you have any things you're not certain about, or any of those danger signals that I mentioned earlier on, please go and consult your doctor. And so I shall just stop there. Let me have a quick look in the chat box, because as I was talking, I could see the numbers going up. Let's see what people have said. Okay, so different people have said different things. Let me just have a quick scroll through and see first. So people say, do we need exercises on a daily basis for neck and lower back pain? Whole grain, harder to digest. Of course, it depends on different people's whole grain, not advisable for elderly, harder to digest. A lot of it depends on your pre-existing health condition. So if you are haven't got any gut issues, these sorts of things you would probably best discuss with your GP. Or so if you have to avoid high potassium food, it means that probably that you have some kidney problems. And if you have to avoid whole grain, then you may be able to get your fiber from other sources. So there are exercises that you can do to correct neck and back pain, including stretching. If you go on to, in fact, there are lots and lots of sites online that show this. Maybe what I can do is I can have a look for some and send them to Angie, and maybe Angie can post them somewhere. But there's a website, a UK website called Versus Arthritis, versusarthritis.org, I think, .org.uk, which is a charity based in the UK that have got lots and lots of exercise leaflets. So if you go to that website and you search neck pain or back pain leaflet, there will be leaflets, as well as I believe there are videos as well that show you how to do certain exercises to stretch and strengthen your neck and back. So I think most of these questions that I've had here, I have already addressed in my talk. About so the recommended dose of vitamin D per day is between 800 to 1,000 units for most adults, unless your doctor has recommended a higher dose. How to sun yourself under the sun? Arms and legs exposed, go out for a walk, 10 minutes at 10 o'clock. Okay, so back again for if you have wear and tear or degeneration in your joints, don't care whether it's back or neck or knees, the things that you have to do are, first, correct your posture. So if you have flat feet, do wear shoes that are supportive with insoles, or sports shoes, okay? Second, make sure that your workstation is aligned such that you are not looking down and hunching over your keyboard. So make sure that the screen is high enough, the font is big enough, such that you don't have to squint and hunch over. Get an external keyboard if necessary. Prop the laptop up and get an external mouse. Get a high back chair, sit such that you are sitting right up against the workstation, so that your shoulders are against the back of the chair and your bum is right up against the back of the chair as well, so that you are not curving your back forward like this, okay? The other things to do, make sure you do when you are sitting is make sure you sit with both feet flat on the floor, touching the floor, not crossing your legs, because if you cross your legs, you are forcing your spine to tilt to keep you upright. Then make sure that you're not sitting there in that one position for hours on end. So what I do now in the clinic is I make sure that I get up and take a break every so often, get up, stretch, go to the toilet, go and get a drink or whatever. So even when I'm at home, I set my phone alarm to remind me to get up and stretch. So getting up and stretch will be getting up and stretching my neck to do the exercises the physio taught me. The exercises that the physio taught me are relevant to my problem, but may not be relevant to everybody else's problem. Generic neck exercises would be things like looking up all the way, looking down all the way, looking straight, looking one side, looking another side, and tilting and touching one ear on one shoulder, other ear on one other shoulder, looking straight and tucking your chin in like that. Okay, so one side, hold 3 seconds, up, hold 3 seconds, other side, hold 3 seconds, down, hold 3 seconds, 3 seconds, 3 seconds, and tucking your chin in and straightening up. Those are very basic neck exercises that can be done. But if you're having a lot of pain that's coming down one side, it needs to be diagnosed properly, and then certain exercises will be prescribed and the physiotherapist will work with you on whatever that you have. That is beyond the scope of this talk. If you have, then the other areas to look at are your bed, the pillow, and the supportiveness of the pillow and the bed, and you might try changing these to see whether they suit you. Other things to do with regards posture are to make sure that for people with lower back pain, very often it's the core muscles that are weak. So very often we have weak stomach muscles, which so to start with some simple stomach strengthening, core muscle strengthening exercise will help improve back pain. There are endless number of YouTube videos on this. And I will tell you that I started off when my neck pain and back pain was very bad in December. I started off with the exercises for seniors, okay? Yoga exercises for seniors. I started off with that and gradually graduated on to the next lot, which is yoga for beginners. Okay, so no shame in that at all. It got rid of most of the pain, but it's telling me there, if I'm not careful, the pain will come again. Different people say different things here. I'm a vegetarian. What supplement will help for knee pains? Exercises to strengthen certain muscle groups, making sure that you are getting enough vitamin D, and making sure that you're having a balanced diet. I'm a vegetarian too. Make sure that you are eating across all food groups, okay? And across different cuisines to make sure that you benefit from the full spectrum of a plant-based diet. Let's see. So if you're not sure who to consult, the first port of call would be your GP or the polyclinic, and explain to them what the problem is. Most problems, if they are simple musculoskeletal problems that do not require a referral onto secondary care and the hospital, many polyclinics and now do have physiotherapists and podiatrists. Some of them have podiatrists attached to them that are directly able to help people out in the community. So someone's asking, will the bone spur heal over time? Certain bone spurs, like the ones in the back, it may, once it's formed, it will likely be there forever, for as long as you're alive. So bony spurs and wear and tear, if you strengthen the muscles around that worn area, it usually allows you to function very well with minimal pain and minimal symptoms, even despite the fact that that joint is worn. It's only when the joint is worn out and you have weak muscles as well because of aging. So as all of us get older, aside from the bones wearing out, the muscles also wear out. And when the muscles wear out, the thigh muscles, for example, when they wear out, and when the knee wears out and the thigh muscles get weaker because we spend all day sitting and we are getting older, the thigh muscle is not strong enough to pull the lower half of the leg up at that hinge, and therefore it worsens. Slight malalignments will cause increased pain in the knee. So once you have pain in the knee, the muscle that kind then doesn't want to work so well, and then you avoid walking on that and avoid using it. And when you avoid it, then the muscle will then weaken further. So very often for mild to moderate knee wear and tear, and in fact mild to moderate wear and tear in other places, the first and most important step is physiotherapy, and then of course weight loss as well, to make sure that physically the body's alignment is as optimized as it can be, and then and the muscles are as strong as they can be. Of course, if the wear and tear goes beyond a certain point, for example, if your car needs to be in the workshop every month, you might think of getting rid of it and getting a new one. The same is true of knee pain. So if the knee pain is so severe, the knee is all crooked and the knee pain is so severe that you're on like 2-3 kinds of painkillers, and you feel that this is really terrible, and your level of function is really poor, and you've done everything else that you can, then maybe it's time to talk to the doctor about other options. Options of knee surgery, for example. Okay, someone's asking about jogging and knees giving problems. Yes, jogging. It depends on the surface on which you jog. Make sure that the shoes that you wear are as shock absorbent as possible. Collagen supplements, unfortunately, have not really, like glucosamine, been shown to do anything to help structurally change wear and tear. It's been shown to help reduce pain. So it reduces all the trials on collagen, and have used a particular pain score as the judge of whether it's effective or not. So all those that have all the cases of publications that have said that collagen works, actually works for what? It works for pain. It hasn't been shown to work to make the cartilage grow back per se. Someone's asking me about a chair called Secret Lab. I don't know what that is. So massage is one, someone's asking about massage. Massage is one means to help aches and pains, just like aromatherapy, just like relaxation, just like sitting in a jacuzzi, or going for a swim. These are all means to relax the muscles and can help relieve tense muscles, which can be one of the causes of body aches as well. Neck exercises, like what we say. Pillow, different people find different pillows useful, so I would say try different types of pillows. Some of my patients swear by thin pillows like those made of buckwheat, but really a lot of it is trial and error to see what works for you. Moderate exercise is important to make sure that for general health, for heart health, and the health of the rest of the body, moderate exercise also produces a lot of good chemicals, which reduces your risk of other illnesses as well. And if you have inflammation type of arthritis, like rheumatoid arthritis, moderate exercise, once the condition is controlled, has been shown to help improve control and improve general control of the disease as well. So you can't really swim and run to prevent inflammation in joints. It doesn't work like that. But it does. If you did have joint inflammation that was already controlled by medications, some moderate exercise will definitely help the general control of the condition. If you have wear and tear in the joints, moderate exercise will also help your overall level of function and help improve the strength in your muscles so that you have fewer symptoms. Can cartilage be replaced or grow back? Experimentally, yes. But commercially in Singapore currently, not as far as I know. There have been researchers, surgeons overseas who have presented research work where your cartilage is harvested and the cells grown into a certain 3D printed scaffold and then put back in your body. But that is not yet available to the masses. It's available in an experimental form in certain centers only. Can you combine acupuncture with Western medication in pain management? Yes, you can. Acupuncture is a very well-recognized and evidence-based means for pain control. And if it works for you, do go ahead, but do make sure that you are going to a reputable acupuncturist and not, one that is not reputable, because sometimes the not reputable ones, if they are unregistered, then the usage of needles and things like that may transmit diseases. I have had a case of a patient who contracted hepatitis B after having acupuncture done by an unlicensed acupuncturist. So do please be really careful if you are going to seek complementary therapy. Do make sure that it is also from a reputable place. So people are asking about climbing stairs and knee pain. Like I said earlier on, if you have knee pain, first thing to do is exercises to strengthen the thigh muscles. So you can go and look up on the website that I mentioned earlier on, versusarthritis.org.uk. I think it's, or maybe it's versusarthritis.org only, and it will there are exercises on a leaflet on knee pain, and these are exercises specifically to strengthen the quadriceps muscles. So they have some simple ones to do for 6 weeks, and then after that you can do more complicated ones like squats, and by the time you can do squats, you can climb stairs, no problem. Gua sha, so someone's asking about gua sha. Gua sha, like acupuncture, is like a form of almost like massage. It irritates the lining of the, it puts pressure on certain parts of the muscles and the skin to reduce the signals that go through the pain nerves. So it can help some patients for pain management. So I have answered most other questions already. People are asking about things like plantar fasciitis. Plantar fasciitis is inflammation at the base of the heels. That again, by changing the alignment of your feet with insoles, custom made if needed, or having sports shoes will definitely help.
Thank you so much, Dr. Koh. You've been so kind in answering the multitude of questions with your most care and genuine way as usual. I'm always so touched and impressed by Dr. Koh's eagerness and also her very clear explanation in explaining her area of expertise as well as responding to all the questions. So please join me to thank her, and we are certainly inviting her back. So yes, more work for all our good speakers. We always bring them back.
Yes, it's always a pleasure. I feel that health education and being in control of your own health and seeking out proper healthcare resources is the only way that we can combat misinformation. It's really, really important now. In this current climate and this day and age, health literacy is really important.
Indeed, thank you. And I mean, there's so much on Google, and if we don't rely only on the information from reliable sources, we could be so misinformed, as we are seeing with vaccinations. The stuff that comes out, the conspiracy theories, they're not very helpful. And so we need to just focus on going to the right sources for information that's reliable. So I'd like to bring to your attention next week, Joyce Low is going to be speaking on art as therapy for trauma, as we promote both happy and healthier living. It's not just the body, but also the mind. And then a week after, I will be sharing on how to transform our negative emotions, all this anger and fear and resentment and jealousy, which sometimes consume us and really takes away a lot of our happiness that we can actually be feeling if not for these emotions. So, and after that, OCD, which has become a big thing on people becoming very extremely concerned about tidiness, cleanliness, especially in these times where COVID-19 is in the air and people can get very obsessive about it. Another form of OCD, some people consider hoarding as an OCD behavior. So come and learn from the psychiatrist, Dr. Victor Koh, who is the head of the Department of Psychiatry in Seng Hospital. And one of Dr. Koh's colleague, Dr. Ng Wee Kun, will be sharing on diet and gut health. And many other programs, including exercise programs that Dr. Koh was promoting for all of us to do more exercise. Well, you can join us in online exercise programs as well as in the center. So we have as much as possible and curated programs that will help you stay healthy and happy. So before I end, once again, I'd like to remind everyone to register for the Asia Pacific Mindfulness Conference. It's an amazing conference and it's free webinars till the end of this month. So don't miss out on it. After that, you'll be paying $100. But even then, you can donate that to support this conference that we're working very hard to deliver to you with a panel of more than 70 international, local mindfulness and healthcare experts. So with that, I'd like to thank Dr. Koh again, and thank you everyone for joining us this afternoon, and see you all next week, or see you online at Mindfulness at Lunch or Unwind at Sunset with a lot of stretching, or at one of the many programs. Take care, everybody. Thank you once again.